Hi, I'm Earl Silverman, editor-in-chief of the Journal of Rheumatology, and this is the second month that I'm interviewing the senior author of a paper I've selected to highlight in my editor's tips. The full interview will appear as a video on our website and on YouTube, and it will be part of my monthly podcast of editors. For the month of February, the article I picked is entitled, "Does the one-year decline in walking speed predict mortality risk beyond current walking speed in adults with knee osteoarthritis?" It is by Master and colleagues from the Universities of Delaware, Vanderbilt University, Boston University, University of North Carolina, and Harvard University. The paper is now available on the journal's website at jroom.org for your viewing pleasure. Now I'm pleased to be speaking with Dan White, who is the senior author of the paper. Dan, I want to thank you for taking the time to speak to me and to our listeners about your very interesting article, an important article examining how changes in walking speed may predict mortality in people with knee osteoarthritis. I guess people are now saying person, but we'll stick with people in old fashioned. So if we start, could you briefly review the design of your article and highlight the important findings?
Sure, my pleasure. Again, just thanks so much for having me. It's a pleasure to be here, and it's an honor to be featured again. And I do acknowledge the first author of this paper, Dr. Hiral Master. She put a tremendous amount of work into this paper, and is certainly, I wanted to recognize her contribution on it. This paper, basically what we did was we used observational study design. We took data from the Osteoarthritis Initiative, which is a publicly available data set of people with or at high risk of knee osteoarthritis, and these individuals are followed and measured annually. And what we did was we took a look at how these individuals were walking with a 20-meter walking speed test, and looked at their walking speed at baseline, and then looked at how their walking speed changed from the previous year to that baseline visit. And then over the next 11 years, we looked at mortality, all-cause mortality in those individuals. And basically what we found was that those, in our main question was, is the gait speed or walking speed taken at that baseline visit, which we really wanted to emulate what a clinic visit would be in front of a physician or a health professional, whether that provided enough information to gauge what the mortality would be, risk would be, or does the gait speed change over the past year add any additional information? That is the notion of changing or someone declining in their gait speed. Does that better predict what one's mortality would be or the risk for mortality over the next 11 years? And what we found was that it was the baseline gait speed and not the change in walking speed that was important to predict mortality risk. And this is a sort of important for two reasons. The first is that it confirms what has been sort of known in the general aging literature and has more recently become known in literature for osteoarthritis, and that is that walking speed or gait speed is an important marker of future health, and specifically in this case of all-cause mortality for people with knee OA. And the second reason this is important is that that the clinical question of how has someone's decline been versus how are they currently in front of you. With this paper, we believe that it's what's in front of you that's the most important for their future health risk, in this case, in terms of walking speed predicting future mortality. And while there might have been some decline or some change in the past year, that was less important than what took place at that baseline visit, again, which emulates the clinic visit that a provider would see with their patient. And so we thought that would be important information to share with the readership.
Yeah, thank you. That was really excellent explanation. So my question just leads from that, it was fascinating to me that either baseline or change in a year would predict something 11 years later. So that led me to think, why did you hypothesize a 1 year change rather than longer interval change? I would have thought that maybe 5 years. I mean, maybe that's what you're doing.
Yeah, that's a good question. So in this study, we wanted to have, from a practical perspective, as tight of a timeline as possible. Namely because you see your patients, let's say annually, but beyond that, that several years ago, for something to happen, we would just imagine is less clinically important than visits that happen more proximally. So in the OAI, ideally what we'd have is more frequent visits that were 3, 6, or 9 months in the past. But unfortunately, the OAI collected data only at 1 year intervals. So that's the reasoning behind choosing those intervals. It was more clinically driven. In previous work our lab's done, we have found that trajectory patterns of gait speed taken in healthy older adults over a 3-year period of time. So not this study was 1 year. Gait speed taken over 3 years was predictive of mortality risk. So your point is well taken that changes in gait speed over a longer term might be more predictive than a baseline. But that's all nice, but again, clinically, it's what it's a year out would be really the longest one would recall, and what in fact what you see at that clinic visit has the most weight, it appears, for mortality risk.
No, I'm not putting down. I think it's really important that you see somebody, you look at it and say, "Gee, that may be helpful when I speak to my patient."
Absolutely.
Yeah. So could you just put your article into perspective of what's available in the literature?
Sure. Yeah. So our findings are consistent with what the literature has shown before. I think Stephanie Studensky's sort of JAMA publication, meta-analysis looking at the association of gait speed in older adults with mortality risk really was the most seminal study I can think of that solidified the weight that gait speed, or the predictive power that gait speed has with future mortality. In our study, in people with knee osteoarthritis, confirms that finding, and now it adds that this is important not only for just general older adults, but with our study with people with knee osteoarthritis. Now, it's interesting that our study does contrast that in our previous work, we found that, again, changes in gait speed was important, but apparently changes over a 1-year period of time might not be as important as that baseline gait speed. So that's a sort of a contrast to our findings.
My last question, because after your explanations, there's very little else I can add to. I was just interested in both, obviously, over a 1-year period, you're not going to see a lot of joint replacement. But what about actually, are there issues is there data to address the issue of joint replacement is obviously going to affect your walking time? Does it affect mortality or anything? Do you know anything about that?
Yeah, unfortunately, we did not look at the sort of intercurrent events, including hospitals and joint replacement, in our analysis. So we did not look to see whether people who had joint replacements versus those who did not had a difference in their mortality risk over time. But your point is well taken. And there is a large BMJ article that was published that showed that future health is actually improved over people who did not get joint replacement among people with knee osteoarthritis. And I think they used an advanced statistical analysis to adjust for potential confounders with that. But I imagine the same would be true in this case as well.
No, thank you. That was very helpful. and anything, and very encouraging for everybody who's had a knee replacement.
Yes.
And any further comments you want to add to the audience that I haven't asked you or we have missed?
Yeah, I think just taking a step back and thinking about, what the implications of this study what the implications of this study are, and in context of just the literature in general. I think this is just very consistent with the notion that as a clinician, it's important to pay attention to how fast or slow your patient is walking. And it does. And I was thinking about it. It's not so much that you need to measure exactly what their speed is and figure out a walking speed course and take this time for a stopwatch and measure it. It's just more or less a general, like, if somebody's walking slow, that's not a good sign. And it is a very strong marker for future health. So for just, the tidbit here is just that information that your gut's probably telling you that this does not look good. That actually has a lot of support in the literature to say that is not good, and paying more attention to that patient and saying they're risk of bad things happening in the future, and I need to keep my tabs on them or get them into a system where they're going to be followed, is incredibly important. And it could just be something where you're just looking at them walking into the waiting room or walking into the exam room, just that split second, and seeing how they are, or in terms of their walking speed is really what we're looking at here. So anyways, that's my main take-home message for this paper that I just like to add.
No, I think that's great, and I think it comes back to simple observations can tell you so much. And I'm sure what you're getting at, it also, you don't have to have knee osteoarthritis, I'm sure, for this to be true, or osteoarthritis anywhere. If you're not walking at a normal speed, something is not well.
Exactly.
All right, well, thank you. Thanks for taking the time, much appreciated. And to our viewers, please read the full-length article. Does the 1-year decline in walking speed predict mortality risk beyond current walking speed in adults with knee osteoarthritis by Master and colleagues? It's available at jroom.org. We'd love to hear your comments either on Twitter at jroom or by email manuscript@jroom.com. And I want to thank you all for joining us, and hope you'll again join us next month when I will speak to the senior author of one of my March picks. Bye for now.